Before we begin, a quick note. This episode includes discussion of eating disorders, disordered eating, trauma, and body image. Please take care while listening, and if you want to skip this episode, we'll see you next week. My guest is therapist Janelle Coolidge, who helps people navigate these challenges with compassion and expertise. Together, we talk about how eating disorders show up, the role of culture and trauma, and how to shift toward body gratitude and real self-care. Okay, let's go. Janelle, thank you so much for joining us today. You're a therapist who helps individuals with eating disorders, trauma, chronic illness, and your experience spans the gamut, but that's where your focus is. Can you talk to us first about what is an eating disorder? I think a lot of us have ideas in our head of what it is. Can you actually define it for us in layman's terms?
Yeah, absolutely. Yeah, because it could be often misconstrued with just disordered eating, right? Eating disorders versus disordered eating. Eating disorder is basically a serious psychological condition, basically, that really impacts your relationship with food and body to the point where there could definitely be some medical complications. So that's why we have to take them very serious
Yeah.
versus disordered eating behavior might be like, oh, I skipped lunch today, or like, or emotionally eating, something like that.
Things of that nature. So eating disorders may involve medical intervention
Yeah.
versus disordered eating, which might be less, not intense. I mean, that can still be intense, but doesn't involve medical intervention. One of the things that I was thinking about before this is disordered eating, it feels like, shows up everywhere in our culture. How prevalent is eating disorder versus disordered eating?
So I would say basically from just our field, from what I heard, I don't know the exact statistics,
Yeah.
but they're saying that eating disorders are the second most dangerous mental illness after the opioid addictions.
Wow.
So eating disorders are number two in like people could actually die, So like, and it's very serious and it's actually very common,
Mhm.
but because disordered eating is so normalized, right? Like dieting and restricting is sometimes praised,
Mhm.
is why we don't realize how common they actually are.
Yeah. And is disordered eating the pathway to eating disorders, or does one precede the other, or do some people immediately go into eating disorder territory?
Yeah, I would say it's kind of like saying it's a risk factor,
Hmm.
but not everyone that has disordered eating will get an eating
Right.
disorder.
Right.
It's just it puts you at a high risk. Just like
Gotcha.
saying not everyone that diets is going to get an eating disorder,
Hmm.
but it's usually when you talk to someone with an eating disorder, there was some kind of dieting in their background.
Yeah. And what are some things that we might misunderstand about eating disorders? And also, what are some things that I don't want to use the word red flag. That's not really a great word. But what are some cues that we should look for of someone who might have an eating disorder?
Well, one thing to talk about is the fact that sometimes people want to assume based on their body size whether they have an eating disorder or not, and say, oh, because you look this way, you definitely have to have this eating disorder. You know, when reality, eating disorders can affect any body, any race, any economic background, doesn't matter, you know. Sometimes the missed flags can be skipping meals, becoming really fixated on the calories of foods, frequent yo-yo dieting, people talking about how much they hate their body or the way they look, you know, things like that, or going to the bathroom right after they eat.
Yeah. Yeah. And and I also should clarify that this isn't for to exactly like you said, look around the room and be like, oh, that person, I think they might have an eating disorder. It's people that you live with and love and care about and things like that. And if you are concerned, you know, and you want to help that person talk to someone else, right? Like, what is the right way to go about it? Because I think what you said is so important. There's no one body type or ethnicity or race or socioeconomic background. It affects everybody. So, what are the ways to maybe talk about it in a way that the other person could receive it in order to take that next step of getting professional advice?
Yeah, it could be very complicated because people, when they're struggling with an eating disorder, definitely don't want to hear,
Mhm.
oh, I'm concerned about this. Like, they don't really want to talk about their food or weight or any of that. So I think it definitely depends. If, it's a friend that confides in you, you could definitely empathize and validate them, and then just definitely recommend to seek professional help because it could be serious. And if it's a parent with a child, I definitely recommend to act quickly and get them professional help, get them to see a medical doctor. Even if they're like, no, what are you talking about? I don't want to, because it's better like to be safe,
Mhm.
as a parent. And as a friend, sometimes as an adult, it's kind of hard to like push them, but you can definitely be there for them and maybe give some resources depending on like how close you guys are.
Right, right. And I would assume this is definitely coming from a non-judgmental way, like not saying like, "Oh, you look so X," or, you
Yeah.
know, I think that probably would shut down the conversation pretty quickly. Is there a reason why, and there's probably lots of reasons why, as I say this, what are the reasons behind eating disorders? And maybe that's not the right question, but is it to gain a sense of control, or are there underlying reasons why this behavior starts and continues?
Yeah. Basically, like the genetics versus environment type of theory. I mean, sometimes eating disorders can be caused by so many different things. Trauma, sometimes they're related due to the person's trauma. Sometimes it's because maybe they grew up in a home where like dieting was a common thing. Maybe they were body shamed. Sometimes, depending on specific eating disorders, ones that are less talked about, like for example, ARFID isn't one that's as well known. That one tends to be like more like sensory related and
Hmm.
like maybe genetics versus the more well known like anorexia and bulimia. Yeah, I guess you could say maybe it's a way to cope through their trauma and some issues or pain that they might have.
And it's so, can you also actually define trauma? I feel like there's so much pop psychology out there on social media, like, and everybody, has trauma. And I'm sort of like, yeah, maybe we all do have trauma, but what is trauma? You're like,
Yeah,
maybe, yeah.
yeah, that's really a good question because that's actually something that even my own child would ask me
Yeah.
because it is talked about a lot. It's very
Yeah.
common. Everyone talks about it. But honestly, I feel like based on what I've studied and with different professionals and just through my work with clients, I would say that trauma is anything painful or adversive that has happened to you that when your brain like kind of like processed it was like, whoa, this is a little heavy for me, and it kind of gets stuck. So sometimes you might have the real obvious ones like a car accident,
Mhm.
but sometimes, like, let's say you were made fun in school, or like they made fun of your hair or the way you talked. And some of those little baby traumas, they will build and build and actually be just as painful as like the more like, oh, I lost someone.
Right. Yeah, absolutely. Thank you for defining that. And when thinking about disordered eating, maybe not necessarily just eating disorders, but it just feels like it's so prevalent in our culture. And, how does, you mentioned diet culture, wellness spaces, like how do you see disordered eating hiding in plain sight and sometimes even being promoted that maybe people haven't caught on to because it is so prevalent?
Well, I definitely will say, like, scrolling through social media.
Mm-hmm.
Most people are probably going to be familiar of like what I eat in a day type
Mm-hmm.
of thing. And it's usually very disordered, like, oh, I ate this thing, or oh, like it has to be clean or whatever, just little seeds that people then start comparing themselves and they don't even notice. So that's sneaky right there. Sometimes, like wellness gurus, people that aren't like trained dietitians with eating disorder training, can be sneaky because people will trust them. And then, it's social gatherings, right? People talking about, I'm on this diet, I'm doing this, and I'm doing that. And, I just want to lose weight. And then it's sneaky and it could cause problems because someone might not even know that their friend is struggling right now
Mm-hmm.
with their body and food, and might not even realize how triggering they just are to that person. Like those are like the sneaky ways that people don't even realize is actually causing like damage.
Yeah. I think the clean eating culture is so fascinating to me because it sounds good, right? And a lot of times you're seeing it and you're like, oh, it's a lot of fruits. And it's, if I see one more thing with cottage cheese, I'm going to scream. But like, you're like, oh, this actually seems legit. And then you're like, wait, but what does clean mean? And what, like when you start diving into it and start looking into the calories, you're like, whoa, this is not okay. Or like even on the flip side, I don't know if you're familiar with the Liver King. Have you seen that
Oh,
guy?
I just
And I'm
saw that.
like, that is not okay. Like eating like raw liver and stuff like and I guess a lot of it is tied to a certain look, right? And I think that's the other thing too. And before we started recording, I'm in South Florida, you're from South Florida, and I was just saying that like I'm amazed at what we just accept as normal and normal bodies when they are clearly not quote unquote normal bodies, whether they have been augmented in some way, shape, or form. And I have no issue with that. But what is shocking to me is, and maybe I should cut this part out. I don't know, you can tell me, but what is shocking to me is this value, is that the right word? This praise of thinness. I mean, it is, and it is, I don't know these people individually, but it does not seem attainable by eating the standard recommended diet and calories that we're supposed to. And it seems like there has to be a lot of manipulation around it. Let's put it that way. And the praise for that and the value of that, and then the judgment of people who don't have those types of bodies, just in common conversation, it's pretty surprising. And I'm surprised at how desensitized I've gotten to it as well. And certainly, I don't know everybody who walks by, I don't know their circumstance or their situation, but it is around me all the time. And you're sort of like, what is a body even supposed to look like at this point? I think that a lot with like Botox and fillers and stuff. And I'm like, how are we supposed to look when we age? I don't even know anymore at this point. But the prevalence of it, and then the assumption on the flip side is if you have a bigger body, that like you're lazy or you're unhealthy or you don't move or things like that. And it's like, we make these, I guess I'm making assumptions about people right now too, but we make these assumptions about each other based on our body sizes that aren't fair or accurate oftentimes. But do you find that like in American culture that there is this virtue, I guess, in being thin?
Yeah,
Yeah.
absolutely. It has some deep, deep roots. Sometimes people don't even realize it. They just go through the motions and they're like, oh, thinness equals good, thinness equals health. And none of that is true.
Hmm.
You can't assume someone's health just by looking at their body, you know?
Yeah.
And we can't always say someone living in a larger body is automatically unhealthy, you know? And things of like you said, like what should a body even look like? The body, you should look like yourself, just like
Yeah.
what your genetics determined for you. And that should be okay. And
Hmm.
that's the thing. I think that a lot of things within our society, maybe there's some malicious intent. Like maybe it is about money.
Hmm.
I know weight loss industries and the beauty industry makes a lot of money out of women and men just about everybody's insecurities. That's how they make their money. That's why they're always telling you to change, right? There is no money in feeling good about yourself.
Yeah, there's no money in feeling good about yourself at all, at all. And I think it's one of the other things that was a realization for me in my early adulthood was like, wait, who said this looked good? Like these ideas that I had of how I needed to look, I've made the assumption as we're talking that we're sort of talking about women, but how does this show up for women and men? Like, do you find that both in disordered eating and eating disorders that it's a majority of women? And how is it for men in our society? And how, that must be a struggle for them too, since we do kind of think of it as something that only affects women.
Yeah. So definitely, I would say more women I've seen will struggle with it, but it doesn't mean that men don't, right? And I think a lot of it could be just because maybe men are more afraid to talk about it. They're afraid
Mm,
to be more vulnerable. It's not really talked about that much in the media,
hmm.
but the way they presents in them is going to definitely present different, right? Because what is the stereotype for women, like, oh, small bodies, right? Or
Right.
but for men, maybe the stereotype is they want you to have big muscles or something, so
Hmm.
those are some of the insecurities. But I mean, for men too, there might also be like, oh, you need to have a small body. So you'll see restriction between men and women. And definitely, you definitely see it in like LGBT communities and transgender, because it's like even more of like pressure,
Hmm. Yeah.
So you're seeing it in everybody. You're seeing it in children,
Yeah.
little kids, girls and boys, and it's all, it's like a cycle.
Yeah.
Start at home, the children hear it, their classmates hear it, and it's just, anybody can be affected now.
Yeah, absolutely. And I think it breaks my heart, like the idea of little kids being affected by this and in taking it. And I think something that you said, I think women also support it in a way, like subconsciously support it, right? Like I remember I was going through this horrible time in my life. I was super stressed and I had dropped a lot of weight. And the amount of people who were like, "You look amazing." And I started saying like it's actually stress. It's not okay. Like I made a point of saying like this isn't actually how I want to look. But those little subversive things, right? Like dropping 15 pounds and oh, you look amazing versus saying like first of all, we probably shouldn't be commenting on each other's bodies, but saying like, "Oh, hey, is anything different in your life?" That's a very different comment than "you look amazing." And now it's like, "Well, shoot, I don't really want to talk about all the reasons why I'm not eating and sleeping," like because it's
Yeah.
it's a praise thing. Are there anything that in our homes or in our friendships that maybe we do thinking it's a good thing to say or do that maybe we should reconsider that you've seen?
Yeah, definitely what you said about, your that period of stress in your life, that there's that unintentional weight loss and then people are praising it. That can really affect someone because you don't know what's happening. And so I don't think it's like a good idea to just comment on people's bodies, you know, because even if it's someone that's intentionally, like, they're dieting, right,
Hmm.
and you praise them, well, there comes to a point where people, they stop the praise, and then that person becomes insecure, like, oh my god, does that mean I've gained the weight? What do I need to lose more weight to get that validation? And it's just a
Hmm.
never ending cycle. So I think we need to be careful, and instead of commenting on bodies, more about like, how are you feeling, how are you doing, tell me more about you, like, what's going on in life, because in the end of the day, we're more than just our bodies.
Yeah, absolutely. I think it's funny too because again, there was a point in my early adulthood in the workplace where it was like, "Oh, you look so cute. Oh, I love your outfit. Oh, I love," and I had to stop myself because you think you're doing a nice thing, right? And people would compliment you back. And I'm not saying you shouldn't be like, "Oh, hey, cute dress, whatever." But
Yeah.
when something external becomes the focus of those little compliments, and like you said, when they stop, it you are sort of like, "Oh, is something wrong?" Or, and to me, I felt like I was invalidating this other person where it's like Wow, you're managing your travel schedule so well. I mean, you can say that just as easily as like cute shoes. You always look so put together, right? Like
Yeah.
and I started to realize like the one of the most uninteresting things about me is the way that I look in my body, but it's a really easy thing for us to just kind of talk about, right? So I think it's interesting again how like it's so ingrained
Yeah.
in so many of our communities, right? Like you don't even realize what you're saying. And I think to your point, like it can shut down conversations really quickly and you're not getting to the actual person and what they're thinking and what they're feeling and those sorts of things. Can you talk a little bit about, this idea kind of tied to that of like you are not your body and especially how it's perceived with someone with like a chronic illness or with an eating disorder, really kind of making that separation of you are not, your external self.
Yeah, definitely. Because I mean, the body is just one part of you, who you are as a person. And it's kind of like the techniques that we give for people with body image. It's more, we try to help them be more like body gratitude, body neutrality.
Mm,
Because sometimes you're like with a chronic illness, you're going to be frustrated with your body at times because you're like, oh, I'm really tired. I just want to be out there and doing the things I love. When those are the times where developing a different relationship with your body where you're like, you know what, let me listen to you instead and see what are you trying to tell me? Are you trying to tell me that we need rest? So you've developed more of that peace and that closeness with your body where you are giving your body what it needs. Like if it needs rest, then rest is productive, right?
right.
If it needs whatever more water, give it more water. It's more about that and being grateful for what it can do, right? Like being grateful if you don't like your arms, being like, I'm so grateful that I can hug my family, you
Hmm.
know, or my walk. I don't like my legs. Well, maybe I'm grateful that I can walk from here to, I don't know, the mall or something.
Hmm. Yeah. Yeah. And it's amazing when, like, I think everybody listening has had this situation in their life where like you hurt yourself and then you realize how much you use that body part. Like I'm pointing for people who aren't watching this. I'm pointing at my shoulder and one time I like threw my shoulder out and it was like I couldn't wash my hair. I couldn't like use a cereal spoon. It gave me so much appreciation for when your body actually works the way
Yeah.
you want it to, not like, oh, my shoulder looks so good because I did 800 push-ups or I don't know. I guess that's how you make your shoulders look good. But like, you know what I mean? Like it really, I love that idea of flipping the narrative of gratitude for your body, whether, you're dealing with a chronic illness or just sort of like an everyday. And for individuals who have a chronic illness, and maybe this applies to eating disorders as well, it seems like there's a loss of control. And how do you help people find that agency in a different way when things are happening to them that are outside of their control?
Yeah. I would definitely say for chronic illness, kind of acknowledging like what their life is going to look like. Because sometimes normalizing that our lives are not going to look the same as other people. You
Hmm.
know, you are allowed to have fun and fulfilling life, but maybe it looks a little different. Maybe you have to balance it with fun, but maybe you need extra time for rest.
Hmm.
And it's okay to have a different life. Like it's still as valid and special and meaningful, you
Hmm.
know. So that's probably what we try to work on with people struggling with chronic illness and trying to adjust to the new life.
Yeah, absolutely. And then this is sort of going back to disordered eating and eating disorders, but do you have any thoughts on Ozempic, Mounjaro, like this outside of like being prescribed for maybe more outside of medical reasons, more cosmetic, I guess, if that's the right way to say it. Like, I find it fascinating. Like, I find it fascinating the rise in, is it GLP-1s? Is that the right? Yeah. Like, do you have any thoughts on that and how that could be affecting us in terms of like body image and just how we're seeing ourselves in each other?
Yeah, that's hard. It's definitely a new thing for like clinicians are in the eating disorder
Hmm.
community because first of all, like sometimes I do get a client that maybe for medical reasons they need to take that medication
Sure.
because at the end of the day it is a medication. And there's some other people who take it and there is no, I think that what makes the difference for me is if they have an eating disorder versus if they don't.
Mm-hmm.
If they have an eating disorder, I find it like that complicates the eating disorder more
Yeah.
because those medications restrict your appetite very
Mm-hmm.
much, that it kind of reinforces what the eating disorder is doing. So like before, they had their hunger cues that would
Mm-hmm.
remind them to eat. Well, with that medication now they don't. So some people with eating disorders, like I've had clients that be like, "Oh, I just had a rice cracker and that's it." And that to me is really dangerous. And I think what needs to happen is that medical doctors should have more training in eating disorders to pre-screen their patients before they give these medications, because otherwise they're going to make their eating disorder worse. Now, someone who doesn't have an eating disorder, I mean, honestly, it's up to that person's
Mm-hmm.
life and what they want to do with it. I mean, again, not everyone that diets gets an eating disorder. It's just a risk factor,
Mm-hmm.
and honestly, I invite that person to really to have a dietitian that
Mm-hmm.
is eating disorder trained, to teach them about how, even though you're wanting to take that medication, right, for whatever reason it might be, to learn about like how important it is. Like, you still need to eat,
Mm-hmm.
because if you don't eat, your body can be real malnourished and you can get medical complications. So that's just my biggest thing, is I feel like providers need to be recommending more like nutrition, and telling people like you got to eat, like you can't
Mm-hmm.
not just go without eating.
Yeah.
Otherwise it's mimicking an eating disorder, right? And if they want to prescribe to patients, please screen them for eating disorders beforehand. You're kind of making it worse.
Yeah. Yeah, absolutely. And so you wrote a book and a journal for body gratitude. Can you talk about that? Because I think, eh, A, I want to hear about it. But can you talk about that journal and the journey that the user experiences when they participate with it?
Yeah, I'm really excited to talk about this.
Cool. Yeah.
So my journal is called My Body Liberation, and it's basically helps. So it's I made it because I had a lot of clients coming to me with body image issues, and so it was kind of like I decided to talk about the things I already talk about constantly and frequently, and I'm like, why don't I make a tool to help people, to remind them to constantly be checking in with their bodies,
Mm-hmm.
and you know try to look at it from the angle of like gratitude. Like, maybe you don't like your body right now, okay, but what is there to be grateful for it? Even if it's hard, or even if you're having a bad day, you can find something like, hey, this body allowed me to be able to hold this journal in the first place.
Right.
I mean, so it kind of helps put the person in the mindset of like looking at your body from a different way, where it's not just about the aesthetics, but more about like what it can do
Mm-hmm.
scientifically. Like my stomach, my intestines, my heart, wow, this body is a miracle. It's amazing.
Yeah, it is really wild when you stop and think for a second. Like, our hearts are beating right now, and we don't have to do anything. Like,
Yeah.
I can hear you. I don't have to actively think about hearing you. Like, it is, our bodies are incredible. Like, and I think what you just said, I mean, they are absolutely amazing. And that reframe is so helpful. Is it the type of journal where like you have to start at the beginning and it takes you through, or you can kind of pick and choose different exercises?
I think so. I kind of like make it look like January, and then like 7 pages after that, and as a way like to like reflect. But honestly, a person can do whatever they want.
Whatever they want. Yeah.
My whole thing is like I just wanted a person to kind of like instill in their brain that it's about repetitiveness.
Hmm.
Like every day, Monday, 7 days out of the week, right?
Right.
Working on whether it's 5 minutes or less if you're really busy,
Yeah.
but more like checking in with that body. So it's more about, I wanted to create that habit throughout the week where you're like taking the time to connect with yourself and take care of it.
Yeah.
But you could do whatever they feel like they need to do.
Yeah. Now, both with eating disorders, trauma, chronic illness, all of those things, how when someone is moving through this and hopefully getting help for this, like how does it affect the larger family unit or community unit? Like, how does, and I don't know exactly what the question is, but I would assume they're like, I'm thinking about my family. And if I had chronic illness, that's obviously going to impact other people around me, not only in the very practical sense, but then also emotionally. Like, what do you see in terms of sort of that impact, and then also how those who are affected, not directly, but within that, like how they can help support each other as well as the individual who's going through it.
So your question is like, how can family support their family member with an eating disorder?
Yeah, I think like whether it's an eating disorder or any sort of trauma that they're working through or chronic illness, not only how the family unit can help support that individual, but then I guess also how the family members can also check in with themselves, right? Because we're obviously impacted by that as well, so that again, you're checking in with yourself and not just sort of ignoring it. Does that make sense?
Yeah.
Okay.
Yeah, definitely for the family, you want to encourage them to educate themselves
Hmm.
about what the loved one is going through.
Hmm.
And also depending on what it is, like for example, an eating disorder, there are groups that are free for family members and loved ones if they are, feeling discouraged or frustrated, where they can just use that avenue for like frustration. So there's books, there's groups, and then simply trying to speak to their loved ones of what they need so they can feel supportive, right?
Hmm.
You know, definitely like if it's a chronic illness, it's going to be more about like trying to help encourage them and remind them that they're not a burden, right? With an eating disorder, you might have to change certain words that you use. Like it might mean that you can't diet while the person has an eating disorder, which I know for some people might be like, oh, but why do I have to change the way I eat? Well, because this person is fighting with something that can like kill them,
Hmm.
basically. So at this time, they need as much support from the loved ones, even if it means like sacrificing a little bit for their sake.
Yeah.
And trauma, depending what the trauma is, just making sure that they know that there's a safe space with you and there's no judgment and validate them.
Hmm. Yeah. And do you find with different racial groups or ethnic groups that there's a different perception of not only what is or is not, you know, an eating disorder or trauma, and also sort of on the flip side in the medical community, how they may or may not receive care for it?
Yeah, I think it goes back to the statistics that people of color, are less likely to have access to mental health services,
Hmm.
right, and care. And definitely, I feel like culture does play a big role in people's relationship with food and body because certain cultures might put a lot of pressure on what the person looks like and talk about weight and body all the time.
Hmm.
And then some cultures might not be as educated or know about the harm of eating disorders,
Hmm.
right? Maybe it's a stigma. They're not allowed to talk about it. So I think that does play a different role.
Hmm.
You know.
Yeah. And then is there a way that, again, and this is just very generic, it's not necessarily that you have an eating disorder or disordered eating, but if I think it's a difficult thing to talk about with someone. Like if I said to someone like, "Oh, you look great," and they had the situation I was in and were stressed, right? Like I didn't want to make other people feel bad about it, right? I didn't want to, but I also felt like I I don't know, it felt really odd for me not to say something like this is not healthy. This is not okay. And I'll give maybe a better example. Like a friend of mine, their aunt is Korean and is always like, eat, eat, eat. You need to eat, eat, eat. And then I'll be like, oh, you look fat. Like there's like these two different like messages that they receive and like, kind of laughed and she kind of laughs about it. But I guess I'm asking in a really non-eloquent way. Like, how can people sort of advocate for themselves in saying like, hey, that's not really cool. Like, that's not okay what you're saying or sort of I think another thing that could be difficult is if you are trying to do something different and your family's like, well, why? Do you have any advice for people on that? Of how they can sort of address that with people that they love and care about and know care about them, but may not sort of have the context of how to say it in a way that the other person can understand.
Yeah, I know that can be really difficult depending on the relationship that the person has with their family. Because some people might be really intimidated, but definitely start practicing those boundaries with, like, hey, I don't really want to talk about my body, or like maybe changing even the subject if you're feeling like, oh, that's a little too scary to be like, oh, no, thank you, I don't want to talk about my body. But I mean, sometimes the person can just change the subject and be like, oh, how are you doing? How's the weather? Anything
Right, yeah.
on the person's body. Because I mean, I see what you're trying to say. Like sometimes it's like natural conversation to be like, oh, your hair looks nice. You look great.
Hmm.
And I wouldn't say those are really, obviously we do talk about there's more to a person than that.
Sure.
I don't think those are as harming. I think the one that we really have to be careful is the body. You know what I
Hmm.
mean?
Yeah.
You know, those are the ones that I really think can cause more issues. Like, wow, you've gained weight, or oh, look, you've lost weight. Like just anything involving with like gaining, losing weight. Like that's a personal stuff that you don't know what that person's going through. They could have a disease. They
Hmm.
could be fighting for their life. They could have a eating disorder. So it's probably just better to just change the subject.
Yeah. Yeah, absolutely. And, you know, are there shifts that you're seeing in how we're approaching these issues or just in culture in general that makes you feel hopeful? I think that like one of the things that bums me out is when I see like especially on social media when I see like skinny talk on TikTok or we kind of talked about it before with like clean eating and things like that. And it's just like, oh my gosh, it feels like it's coming at us even more full force. But are you seeing anything that's giving you hope in the space?
Yeah, I feel like the people that are giving us hope are the younger generations, like millennials, Gen Zers,
Yeah.
because like I think that's where we're gonna have more hope and success. Because unfortunately, even in the medical industry, it's moving, but it's really slow. Like even around Central Florida, like a lot of providers still have that old way of thinking of body equals health, and that
Hmm.
is not true. So I know what I've seen is other clinicians that I work with, like, and even me, like, we try to educate them as much as possible.
Hmm.
And there's been some wins. But where I think I'm seeing a lot of movement is like the younger people. They're really receptive and open, and they're like, yeah, I want to be more than just my body, and they're spreading it. You know what I mean? And they're like trying to move away from that, and they're getting passionate about this. And so like I see a lot of hope there. Like people don't want to live like this anymore, feeling like they're not feeling not free from food, you know what I mean? Just having to be fixated on your body. People want to be free.
Yeah, absolutely. I think about it a lot as a woman of how much time and energy and I've only been a woman my whole life, but which I love, but how much time and energy and headspace I have spent over the course of my lifetime thinking about the way that I look. And
Mm.
like you said, it's a multi-billion dollar industry, whether it's diet culture, whether it's, skincare or hair or whatever it is, like how much energy we put into it. And I actually was thinking about it. This was a while ago, but I was like, I wonder what else, like. I could have been doing with that time. Like I didn't see it at the time, right? Like it sort of bummed me out. I was like, man, like I spent all this time and energy and it wasn't even for me, really. It was about my presentation out in society itself. So it's cool that you're seeing in younger generations that they're breaking free from that.
Yeah,
I even I see it with my daughter and I'm like, I'll say like, you're so strong, like
yeah.
you can, do like praising the body and for what it can do and how she's using it versus like, oh, that swimsuit looks really great on you kind of thing. Yeah. Is there anything else, I know we haven't talked about trauma a lot or chronic illness that much. Is there anything else that we haven't talked about that want us to explore or to know?
I think it's just important to talk about how like common depression and anxiety is
Hmm.
with trauma, eating disorder, and chronic illness, and
Hmm.
how important it is to be mindful of it because they can sneak up right on you.
Yeah.
And so it is important to have awareness of it and kind of like make sure that you're taking care of yourself if you're managing anxiety.
And can you also define depression and anxiety? Because again, I think those are two words that we use all the time, but maybe what are some of the indicators of depression and or anxiety that people wouldn't necessarily notice, right? Like, we think about depression as like, oh, I can't get out of bed, like really big indicators of it. But what are some more subtle things that people are experiencing that they may not even track as this is anxiety or this is depression?
Well, one that sometimes people are shocked about is like sometimes the anger and irritability,
Hmm.
especially in teens and in men, right?
Yeah.
That's sometimes depression, the isolation, the insecurity, low self esteem, low motivation to do things.
Hmm.
Things that used to make you happy don't as much. Suicidal ideations of the thoughts,
Sure.
like that's increasing. The chances are you are probably really struggling because depression is just like it's another psychological condition, right? It's clinical, right?
Hmm.
That does cause a person to be in a low mood.
Hmm. Yeah. And then for someone coming to you, it might feel kind of scary to come to a therapist and say, I have a problem, or even like, I don't exactly know what the problem is, right? But like, I know I don't feel right. Like, do you have any advice for people to, you know, not necessarily get over that hump, but like how to approach it and maybe how to feel a little less intimidated by that first step of, making a phone call or coming into the appointment?
Yeah, definitely. I like to let the people know that that's a really brave thing you did, like you don't know you might not know what's going on, and that's okay, right? You
Hmm.
just know that, hey, I can't live like this anymore. You're seeing a lot of dysfunction in a lot of different areas in your life, and you're just starting to feel like, hey, maybe I could really use someone's help, a professional. And that's okay. I think that's
Hmm.
a really good, strong, brave thing to do. And most professionals, like in the mental health field, like we want to help you. We dedicated our lives studying and doing all these trainings because we want to make a difference.
Hmm.
So even if you're feeling like, oh, this is so silly, it's not going to be silly to us. If it's important to you, then it's important.
Hmm.
So just know that the hardest step is just like doing the research, right? Just looking for a therapist, right? But once you call them and you make an appointment call or email,
Hmm.
after you've done that, it's going to get better. It's going to get
Hmm.
easier. You're going to start seeing like, oh my God, this is so helpful. I'm so glad I did this.
Yeah, absolutely. And how did you come to the work? What interested you in this field in particular?
Yeah, I used to be a nurse first, actually.
Hmm.
And then when I started working in a psychiatric hospital, I started realizing I really like mental health more. and just started noticing that nursing wasn't really a passion of mine anymore,
Hmm.
but mental health and psychology was. So I decided to pursue education in that and decided that, you know what, therapy is something that really is more of a passion.
Hmm.
And I'm really glad I made that decision because I'm way more fulfilled being a therapist than I was as a nurse.
That's amazing. That's awesome. And it also when people are looking for a therapist, like other than if they take your insurance or not, like what are what are some things that they should be looking for? Because sometimes it's like,
Yeah.
like, or what kind of questions should people ask about maybe their therapist methods or how they interact with patients and things of that nature?
Yeah, those are good things. Definitely, it all depends like what your struggle is. Like if you're looking for someone and eating disorders,
Sure.
right? I would definitely recommend that you find someone that specializes in it.
Right. Right.
Because if you get a therapist that doesn't specializes in it, it can be more harm than good.
Right.
So, like making sure that, or substance abuse is another one I really encourage you get someone specialized. So, like finding that out. I think having a consultation call is nice because then you can see if, oh, do I like the personality? Do we click?
Hmm.
Do I feel safe? Trying to see if you can form that therapeutic bond that's really helpful.
Hmm.
As far as like, oh, I mean, you can ask them like, what kind of theoretical approaches do you use? Like, what kind of interventions? Like, and see if that sounds like, oh, okay, I like that. I want that for me,
Hmm.
and
Hmm.
then take it from there.
Yeah. And I think we've all done this, but how do you feel about Googling all your symptoms and coming in with a diagnosis?
How would I
Like,
feel? Yeah. I'm not gonna lie, I've done it too. WebMD. Um,
yeah.
like obviously we all do it, right?
Right.
But the problem with that is that we also have to be mindful that, hey, you know what, we still need to see the professional because the professional has so much more like background information that we don't. Like on the internet, you're just being presented with the list of things. So you
Right.
might have an idea what you might have, but the professional is going to see it like the whole painting basically. So
Right.
that's why, and they're able to provide you with the recommendation treatment and support you.
Right.
That's why it's not so helpful. Plus it gives you more anxiety, honestly. If you
Yeah.
look up symptoms, you start assuming that you're dying after a while.
Right. Right. Yeah. One of the things that I've spoken about this before on here is that like I was really good at thinking my feelings. And so I came in and was like, I know what's going on. Don't worry about it. I was like, that's part of the problem. So, like, to your
Yeah,
point, like not coming in with a diagnosis, I think is really helpful, both in terms of what you were saying about like that anxiety and it,
yeah,
putting that, but also like, I'm sure, my therapist was like, oh, okay. Like, you think you know what's going on. This is not at all what is actually going on. And feeling your feelings, man, it's hard, but it's also great, right? Like I think that's the other thing with and it so agree with what you said of like getting through that first step, like you're going to feel better and you do. I think one of the things that was hard for me to realize is that sometimes it's not fun and sometimes you don't feel good. But you will, right? But like you have to go through that tough stuff to get there and just sticking with it, right? Like and understanding that too is important because sometimes I'm like, "Oh, why do I, why did I just put myself through this?" And then like 24 hours later I'm like, "Oh, I feel so much better," right? Like,
yeah,
yeah. So, on your website, I noticed this. You said that you're a big Marvel fan. And I'm
yeah.
curious, like, who are your favorite or who is your favorite Marvel character?
Ooh. That one's hard because I would say there's, so to specify it, I really love the X-Men, you
Yes.
know. And so within the X-Men, there's just so many cool powers that it's like, I don't know. Sometimes I feel like Jean Grey when she's the Phoenix is
Hmm.
like that's girl power there. But I also like Wolverine because he's like short and like tough and like and I kind of like that. Like that's cute.
Yeah. And why the X-Men? Like, what is it about them?
Wow. I feel like the X-Men, like if you, I don't know if you watched in the 90s. They had an animated series.
Oh, yeah.
As a kid, I was just like, wow, this is so cool. But rewatching as an adult, I'm like, wow, these are like real serious themes here, like for kids. And I'm like, that's what I liked about it. Cause like, you're like, man, this is really dramatic. These are real conversations. Like,
Yeah.
that's deep. And so that's what I liked about them. They're pretty deep and stuff and
I
very
need
diverse.
to Yeah,
Yeah.
very diverse. I need to rewatch it because I remember it being like my sister and I like loved it. Like we loved the X-Men. And I was a big Rogue fan because I thought that was really cool that she could like take other people's powers. Like I thought that was really neat and mimic them. But I need to go rewatch them because I'm sure there were things that went over like went over our heads. I always felt bad for Beast. I was like, "Oh, you're just a big blue dude." Like
So, but he's so smart and eloquent, you know?
Yes. Yeah. Yeah, exactly. And then you're also a Disney fan.
Yeah.
And do you have like a favorite movie or a favorite character?
Man, I really like the old school. Well, by old school, I mean like the 90s.
Yeah, like the 80s, 90s. Yeah.
Yeah, like Belle. She's so like just cool because
hmm
back in the day it was like, oh my gosh, she's so different just because she reads, and I'm like, and I could be like, oh, I read, and I also liked it because she had like, it's hard, you know. They mainly had just light haired
Yeah.
princesses, and I'm
Yeah.
like, I have dark hair. I need to find someone with dark hair. So I like Snow White had dark hair, and I like the Belle had dark hair. I'm like, and then Princess Jasmine. Okay, there we
Oh,
go. So
she's amazing. Yeah,
she's
Princess
the
Jasmine's
coolest
so cool.
person.
Yeah. I think it's funny. I'm laughing because like I was definitely in that golden age of like Disney movies, like the when the hits came out of like Little Mermaid, Beauty and the Beast, Aladdin, Lion King, like all of that. And I remember loving Belle as well. And so did my sister. We're 3 years apart. And so to my sister, for the same reason, we were like, oh, she's smart and she reads. And we never see that. And like looking back on it, it's like, that's so sad. We're like, wow, a girl who reads.
Yeah,
Like,
she's so weird and funny. That's what they say in that song.
I
It's 'cause she's
know.
funny.
I know. And then I also really love the animated Robin Hood. That was like,
That's so cute. I love that one. Yeah.
it was like a fan favorite at home. That was definitely a fun one. It's been fun to watch them with my kids, both Disney and Pixar, like the more recent movies, and talk about how like different the princesses, especially, are like presented now. It's like night and day from when we were kids,
Yeah. Yeah.
which is really cool. Like Moana is definitely one of my like favorites. I'm like, yeah, she's a chief. Like she's she's
Yeah.
awesome. That's very cool. And then, what I think we talked about like a lot of this stuff. I guess the other thing that we didn't talk about, and there's no transition to this from Marvel and Disney to this, but like, what are some, we talked about it with the book a little bit, but like, what are some self-care things that we can do sort of in our everyday that you find are really useful?
Okay. Well, I'm going to show you how I can tie that in.
Okay,
Uh,
perfect.
for example, reading comics. I love
Mhm.
reading comics. I love listening to podcasts on Marvel.
Mm,
For me, that's a really way to take care of myself because I'm more than just a therapist.
mhm.
And I need to learn to you know, put work at work and take care of me. And I think a lot of people can relate to that, that they need to really find something that's a hobby, that's passionate, and
Mm.
just take a break from work, you know?
Yeah,
If you like Disney cartoons, watch them,
yeah.
right? If you like to draw, you know, do something that's fun, that's for you, you know, make jewelry,
hmm
whatever. Just enjoy life, take a break,
Yeah,
relax.
yeah. And then how do you deal with, like, as a therapist, how do you manage your energy, right? Like I feel like it's such an intense profession to be in and to take in all of our, all of your clients' needs. Like how do you manage that?
Yeah, that's hard. Definitely putting some boundaries. Like, if I say I'm done by 6, I'm done. You
Yeah.
know, my clients know, like, I don't provide emergency service or crisis counseling,
hmm
you know, just outpatient.
hmm
So when I'm not working, I'm not working. You know, it's really about family time now, you know,
hmm
and really be mindful and present with them and going for a walk when
Yeah.
you're done, right? Just it's really good. Mindfulness walks, it helps with anxiety, stress, you get your body moving.
Hmm.
So doing things like that, that's helpful.
Yeah, that's great. So, what do you like most about the work that you're doing?
What I like most is to really get in there and engage with the person and just to help them and watch them grow
Hmm.
is really rewarding. Help them find healing and peace is really nice, and it's worth all the work that you did. Just knowing you made a difference in their life. So I would say like that's one of my favorite parts.
Yeah, your face just lit up when you were talking about that. And what advice would you give to your younger self, knowing what you know now? And that can be in the context of anything that we've talked about or something that we haven't talked about.
I would tell her to don't stop worrying about if people like you or not, or if you're weird. I will tell her that you're a really cool gal and you're going to make a big difference and just keep shining bright.
Yeah, I love that. And how can people find you? Oh, and that's the other question that I have. How can people find you? And do you do virtual therapy as well as in person or only in person?
I do virtual
Hmm.
and I do have an office for in person.
Okay, cool.
My website is www.coolskiescounseling.com.
Hmm.
I also have an Instagram. It's called at Cool Skies Counseling.
Hmm.
And yeah, I
And people
think
could reach out that way. Yeah, yeah. We'll have all of that in the show notes and all that kind of good stuff. But I love your website because I feel like you really get a sense of you, like, so that's awesome. Well, thank you so much for spending so much time and talking us through these things. These are really big and dense and heavy topics, and I appreciate you sharing your expertise.
thank you so much for helping me do this because I really enjoy doing these things and you're helping me grow and you make me feel like a celebrity. So thank you.
Thanks for listening to Wait, What Do You Do Again? For more information about today's guest, or if you'd like to be on the show, please visit megdeford.com. See you next time.